Hello, my name is Marci Gill, and I'm a myofunctional therapist in the Phoenix, Arizona Valley. My training was done out of California with the Academy of Orofacial Myofunctional Therapists. I'm going to discuss with you today pediatric snoring and sleep apnea. You may have noticed this topic is getting quite a bit of national attention lately. You may ask why. It is certainly not a new problem. But now we have a definitive scientific research study that supports the idea that sleep disorder breathing and behavioral sleep problems in children affects their cognitive behavior and their language development in your child. This report shows that the odds are greater than 40% that your child who's experiencing sleep disorders will need a special education program because of reduced cognitive ability. Karen Bonnick, PhD, published this report in 2012 after studying greater than 11,000 subjects in over a 12 to 15 month period of time. She works at Albert Einstein University in New York. Her study appears in the Pediatric journal, which is the official publication of the Academy of Pediatrics. The complete study can be downloaded from my website at omtphoenix.com. That stands for Orofacial Myofunctional Therapy.com or Phoenix.com. So what is it that you should be looking for in your child? You should be aware of consistent snoring and also apnea, where actually the breathing is stopped for a short period of time. And also an open mouth. Does your child have their lips open all the time, or does he or she rest them together while breathing? So what exactly does a myofunctional therapist do to treat this disorder? A myofunctional therapist manages symptoms by incorporating a series of exercises designed to address the orofacial habit that causes this dysfunction and repatterns the muscles. Let's talk a little bit about improper breathing. This example can be caused by large tonsils, large adenoids, allergies, or a deviated septum. Myofunctional therapists use a multidisciplinary approach, which incorporates the services of many doctors. These could include an oral surgeon, and it could include an ENT, an orthodontist, craniofacial osteopath, sleep therapists, and even chiropractors. We will also stay in close touch with your primary care physician. By doing this approach, your child will experience the best results possible. So why not just go to the ENT or the chiropractor? My best example I can give you would be relating the protocol to having a knee replacement done. Your orthopedic surgeon will come in and replace the damaged parts of your knee. He will change the form with new parts and give you a whole new knee. By doing this, you will be able to function properly, but not without the help of a physical therapist. Many months of work is needed by you to do these exercises. And that therapist will help you regain the function of your knee. It's the same thing with orthodontics. They will change the form of the teeth, but the function sometimes is not addressed, and many people find that their orthodontics is relapsing because the proper balances have not been made within the mouth to change the position of the tongue or change the swallowing or whatever muscle might need to be correcting. So you must properly be evaluated by a myofunctional therapist so the function will follow form before, during, and after any treatment for orthodontics, tonsillectomies or nose surgeries, sleep studies, or snoring in both adults and children. So what are the long-term effects of not treating these dysfunctions. Our generation is experiencing long-term effects of improper tongue position, breathing disorders, and swallowing. Sleep apnea has been reported in epidemic proportions now, and the effects of this untreated sleep apnea has now been documented by Karen Bonnick in children. The adult's symptoms can be a shortened life expectancy, fatigue, high blood pressure, weight gain, type 2 diabetes, coronary artery disease, and acid reflux. So why not schedule an evaluation with a myofunctional therapist in your area to have a healthier future and lifestyle and have your issues discussed? I give a free evaluation in my practice and would love to talk to you about your problems. Please contact me at omtphoenix.com. There are also other dysfunctions that I address on the website, and they include improper tongue position, sloppy eating, head, neck, and TMJ pain, lisps, and thumb sucking. Thank you for your attention.